Today we are going to be discussing a citation that the Illinois Department of Public Health recently issued to Miller Healthcare Center in Kankakee after a resident there suffered a fractured hip in a fall. My name is Barry Doyle. I'm a lawyer in Skokie practicing nursing home abuse and neglect work throughout the state of Illinois. I'm also the author of Built to Fail, a free report available for download from my website, which spells out how the nursing home business model inevitably produces unnecessary injuries and deaths for nursing home residents. There are two main factors which place residents at risk for suffering falls. One is having some type of gait or musculoskeletal or balance dysfunction, which makes it difficult for residents to maintain their balance or get up or down from a seated position. The other is some type of dementia or confusion, which limits the ability of the residents to make good decisions regarding their own safety and to follow necessary safety instructions. The resident who was involved in this fall had been assessed as a fall risk, and a fall prevention care plan was put into place. When a resident has falls, this is something which should trigger a revision of the care plan for two reasons. One is that the occurrence of a fall is a sign that perhaps the fall prevention care plan that's in place is inadequate, and the other is that we know historically that the occurrence of a fall tend to beget additional falls, so there is a higher risk of additional falls. In this particular case, before the fall where the resident suffered the broken hip, she had sustained 3 falls in the 2 weeks leading up to this. However, this didn't trigger any type of revision of the care plan. The existing care plan remained in place, even though 3 falls in 2 weeks was likely an indicator that this was not a sufficient care plan. On the day of the fall, this resident was left alone in her room. She got up from her wheelchair to take a menu to hang it on her door. As she did so, she lost her balance, she fell to the floor, and suffered a broken hip, which required surgery. The investigation into this particular incident revealed 2 particular findings. One is that at the time of the fall, the resident was not wearing shoes and was not wearing non-skid socks. Having proper footwear is a basic fall prevention care measure. It helps reduce the incidence of falls. If residents aren't wearing shoes, they should be put into non-skid socks to reduce the chances of slipping and falling. The other is that the resident was not being supervised in the day room. One of the most effective fall prevention measures that a nursing home can take is to keep residents who are at risk of falling in places where they can be easily supervised. Commonly, this is the dining room or the day room or by the nurse's station, but leaving residents unattended in their own room when they have some type of dementia or confusion, which makes it unlikely that they will follow instructions and make good decisions for their own safety, is something which really is an ingredient for an increased likelihood of a fall occurring. In this particular case, the nurse who was on duty at the time of the fall said 2 surprising things to the surveyor or the inspector for the State Department of Public Health. The first of these is that she admitted to the surveyor that she doesn't actually review care plans, and the second is that she didn't even know how to find them in the computer. The care plan is supposed to be the result of a comprehensive assessment which really addresses in a systematic, organized way the resident's risk of the health and well-being of the resident, including the resident falls. If the care plan isn't being considered, isn't being addressed in the care that's being provided on a day-to-day basis, the care plan really has no real utility in helping keep the resident safe. This leaves the provision of care that a resident's going to be receiving on a day-to-day basis to random chance, to the particular judgments that a nurse is making on the spot that day. This defeats the whole care planning process and is a real indication of systemic problems at this particular facility. If care plans are being developed but not even being reviewed and considered, and the staff doesn't know how to access them in the computer, this is a indication of real serious issues regarding the training of the staff and the overall provision of care to residents at this particular nursing home. I hope you found this interesting. If you have any questions regarding this or any other nursing home abuse and neglect matter, please feel free to reach out to us. Our number is 312-263-1080, or we can be reached on the internet at www.accidentlawillinois.com. Thanks so much for watching.